News from the Borderland. This is EPAS Unleashed. Hi, everyone. Welcome back to EPAS Unleashed. I'm your host, Jessica Navarro, and we have a very special returning guest, Dr. Rubio from TLC. In case you missed our last episode with Dr. Rubio on holiday pet care tips, we are going to reintroduce ourselves. So can you go ahead and give us a little insight of where you work and how you became a vet?
So my name is Dr. Priscilla Rubio. I went to vet school at Texas A&M. I became a vet because that's what I wanted to do ever since I was little. I always wanted to be the voice for the voiceless, so that's really what drove me there. And I am a small animal veterinarian at TLC Animal Hospital right now.
Awesome. Thank you so much for joining us again. I know you have a very busy schedule, so we appreciate getting a chance to talk with you again. Today, we are going to be talking about spaying and neutering. That's a big issue here in El Paso. So we just want to kind of discuss what you all see clinic side versus, the shelter medicine. So in case people don't know what spaying and neutering is, can you just tell us a little bit about the difference and what the procedure is like?
So spaying is referring to females and neutering is referring to males. For females, spaying will include removing their uterus and their ovaries. And in neutering, it involves removing the testicles. They have a lot of benefits, both medically, behaviorally, and also for overpopulation reasons. So, starting with the medical benefits, there's a lot of issues that can come with dogs remaining intact, especially for females. Mammary cancer is a big thing, and also pyometra, which is a fatal uterus infection. Those are all very preventable with spaying. And for males that get neutered, the benefits will include preventing testicular cancer and then diseases involving the prostate. And then behaviorally, it does help to reduce marking behavior. So when they're raising up their leg to pee everywhere, to leave their scent. And then also male to male aggression and roaming behaviors where they're trying to escape the house to try to find a mate. All of those behaviors do get better with that.
Yeah, definitely. And not only medically, do you see that here in El Paso? Those issues coming into your clinic. Do you see spaying, not spaying, those issues happening here?
Yes, a lot. A lot of owners. Some owners are great about spaying and neutering. Others maybe just for misinformation reasons don't want to spay or neuter their animals. But yeah, overpopulation is a big issue that I see. There's constantly dogs that come to us that were found on the streets or were dumped somewhere, and that's all due to there just being way too many dogs and cats out there. Um, and as far as medically what I see, I do see a lot of pyometers, which are very devastating situations because by the time the owners notice these symptoms, the dogs are very, very sick. They do require an emergency life-saving surgery at that point, which can be very expensive. Not everybody is prepared with those finances. Even if they are, some dogs aren't stable enough to survive the surgery. So it puts us in situations where euthanasia is most of the time elected in those cases, and it's just very sad because that could have been prevented with the spay.
Yeah, and we're definitely going to be talking a lot about misconceptions in this episode because I feel like the community, they hear things and they go with that instead of maybe getting it from a professional like yourself. So one that I know I hear a lot is to allow the female to have a litter before spaying them. How true is that?
So that's not true at all. I think that's interesting. I've never really heard or learned about that before until I started practicing as a doctor. Clients will tell me that all the time, and I truthfully have no idea where they're getting this information. But I think maybe just as a human, you think, maybe they want to have that mother to children connection. But realistically speaking, dogs don't have that the way that humans do. But there is no proven benefit to them having a litter beforehand. It's actually better to spay them before they have their first heat cycle. Reason being is that when you spay them before the first heat cycle, I think the percentage is about like 90 something percent protective against mammary cancer. If you wait to spay until after the first heat, it drops down to like 80, and then third heat, I think it drops all the way down to 40 to 50%, somewhere around there. So the more heat cycles that they have, the less protective it is against mammary cancer. So it's actually better to spay as soon as possible.
Mhm. And yeah, kind of speaking on that, I mean, a lot of people think, oh, my dog or my kitten, they're babies. They're not gonna have babies themselves. But can we talk about how young an animal can be to reproduce?
So that's a good one. They dogs can start getting pregnant as early on as 6 months of age, because that's when they have their first heat cycle. Their heat cycle can happen anywhere from 6 months to maybe larger breeds, anywhere from 1 to a year and a half of age. In cats, it can happen a lot sooner. They can have their heat cycle as early as 4 months of age. So once they have their first heat cycle, they're ready
Yeah.
to get pregnant. So yeah, there's definitely a lot of young dogs that aren't ready physically because they're still growing themselves, they're still developing puppies, but they're, carrying a litter, so that can cause a lot of health issues for them, and also just emotionally that's very traumatic for them because they're still in that puppy or kitten mindset and they're just not ready for a litter.
Yeah. And kind of speaking on that, litters, we do get that those people that think that, oh, their brother and sister, they're not gonna reproduce.
Mhm.
They wouldn't do something like that.
Yeah, but they would. Yeah, no, definitely. I get that a lot too with clients, that they think there's no concern for reproduction because they're from the same litter. But animals, again, they don't think the way that humans are able to think. They have no idea that the dog next to them is related to them. Animals are driven by instinct. So by instinct, they will reproduce and mate. So yeah, that's also a myth. They are not able to recognize if they're from the same litter or not.
Yeah, we definitely do put a lot of our human emotions onto animals, and I feel like that's where a lot of misunderstandings happen. We also get a lot of our pets are indoor pets. They don't need to get spayed or neutered. Can you talk a little bit about that?
Yeah, so indoor pets, they're still at risk of getting pregnant, or a male, they're still at risk of getting another dog impregnated, because there's always the chance that they might escape. That always happens. Dogs
Yeah.
jump into people's yards or the door got left open, they escape. And then also there's the medical side to it. We want to prevent things like mammary cancer, testicular cancer, uterus infections, prostate infections. We want to prevent all of that, which all of that can happen equally to indoor and outdoor dogs. So it's definitely important, even if they're indoor only.
Yes. And some people, maybe they're hearing this and they're thinking, "Oh man, I should get my pet spayed or neutered," but maybe they feel like their pet is already too old. Can we talk a little bit about that?
Mm-hmm. Yeah, so I always tell clients old age is not a disease. I think people are worried about spaying and neutering at an older age because they're worried about risk under anesthesia. So if they're already at the point where they're geriatric dogs, which I consider them geriatric maybe at 8 years and above, there's obviously precautions that we take to make sure that they're safe candidates for anesthesia. That can include doing a blood work to make sure that their liver and kidney function is okay. We can always do x-rays of the heart to make sure that their heart function is okay. We always do a full physical exam to make sure that we don't hear heart murmur or see anything that's obviously wrong that would make them bad candidates for anesthesia. But we do take those precautions. If all of that is okay, then there's no reason that they wouldn't be able to go under anesthesia. And if you weigh out the risk the risk versus the benefit, again, you're preventing your senior dog from possibly getting a pyometra, which when they're older is when they most commonly get this uterus infection. So if your dog is already older, it's better to spay them before, they're at risk of
Yeah.
that.
Yes. And some people, I was one of these people that thought, "Oh, it's too painful. Like I don't want my dog to go through pain." So can we talk just a little bit about that?
Yeah, no, I mean, we definitely have a really good plan for pain control for these pets. The procedure itself, it's a pretty quick procedure. It's a routine procedure that vets do every single day. Um, but of course, beforehand, they do get sedation drugs. They get drugs during the surgery as well. And they also get medication sent home with them for the recovery period. So the pain control, we do manage that very well. And the pain really is minimal. Most dogs, that same day, believe it or not, they will go home and run around. We'll send them home with their cone to make sure
Yeah.
they don't lick their incision. But they're back to being hyper, they're eating, they're happy. They don't even notice that they got a
Yeah.
surgery done.
Uh-huh.
So yeah, I don't think it impacts dogs as much as we might think that it does.
Yeah, definitely. Working here at the shelter, I was so scared before, getting my pets this procedure, but now I see it all the time and I'm like, no, it's just like you said, a routine procedure. It's not, as bad as it, I guess, sounds to some people. I've also heard a lot of concerns with like weight gain after getting their pet spayed or neutered. Can we
Mhm.
talk a little bit about that?
Yeah, so weight gain is an issue, but it's not directly linked to the procedure. What
Hmm.
happens is when you're neutering and spaying, you're removing their sex hormones. Sex hormones have an effect on your um, metabolism. So when
Hmm.
you're removing it, your metabolism does slow down a little bit.
Hmm.
So you do have to adjust the amount of food that they eat accordingly. So
Hmm.
usually it's anywhere from 10 to 30% that their metabolism slows down. So ideally you want to reduce their food intake by 10 to 30%.
Hmm.
The issue of weight gain comes along when owners continue feeding these large amounts of food
Hmm.
and their metabolism can't catch up to it, and then they blame the procedure for them
Hmm.
gaining weight, but it's not directly linked to it.
Okay.
Mhm.
And then, of course, this is one that we hear a lot is I can find the litter a home. I can
Mhm.
find them all a home.
Mhm.
Um, I'm sure you probably hear that as
Mhm.
well. Can we talk about that?
Yeah, I mean there's many factors to that. Number one is you might not. You might think that you're gonna find them all homes, but it's a lot harder than you think.
Yes.
It's a financial commitment, it's a time commitment, it's responsibility. Um, you might think that puppies are or kittens are easy to find homes, which I agree. Kitten, the younger the pet is, it's easier to
Mhm.
find them in a home versus an adult.
Mhm.
But even then, not everyone is able to take in a new pet responsibility. And also, it just adds to the overpopulation issue. A lot of people, not everyone, of course, it's not generalized to everybody, but I sadly do see that people will adopt when they're kittens and puppies and they love them, but the second they turn into adults, they end up in a shelter, they end up getting dumped in the streets. Suddenly they can't take care of them anymore. They're too big, it's too much to handle. So even if it was easy for you to find them at home and they were cute and tiny, once they're big dogs, especially the larger breeds, they
Mhm.
a lot of them do end up having to get rehomed or in shelters, even euthanized. So it's
Mhm.
definitely an issue.
Yeah, yeah. And March was National Pet Vaccination Month. Of course, here we do see a lot of parvo distemper in this community. Can you talk a little bit about what you all see in the clinic side?
Hmm. Yeah, we do see a lot of parvo. I will say parvovirus, we see a lot more commonly than distemper virus, but distemper is a lot more fatal than parvo. But parvo and distemper, they're both very common in young puppies. Reason being is that they don't have the full immunity toward them like an adult vaccinated dog would. With parvo, the main symptoms that you'll see are going to be vomiting and diarrhea. They're just not doing well. For distemper, it's similar symptoms, but then there's a respiratory and neurological component to it. So you might see symptoms like boogers and then neurological symptoms like head tremors, maybe even seizures if it gets that serious. But all of that, again, can be prevented with taking proper care of your puppy. So getting them their vaccine boosters accordingly. There's a time frame. We do recommend puppies get vaccinated anywhere between 6 to 8 weeks old. That's when their first series starts. After that, they do need vaccines every 3 to 4 weeks up until 20 weeks old. The reason we recommend 20 weeks old is to ensure that they are getting all the antibodies that they need for full immunity against this virus. It is very important during this period. You know, people think, oh, they got their first booster, they can run around in dog parks. That's also a myth. Until they're fully vaccinated, we do recommend isolating them from any other strange dogs, public places, even including, you know, a stroll around PetSmart, dog park groomers. Avoid all of that until they get that very last vaccine at 20 weeks old, because they are still prone to getting infected with those viruses until then.
And yeah, the reason I bring that up is just because, we do see a lot of people that may like get from backyard breeders.
Mm-hmm.
And I know a lot of times those pets are not vaccinated. So I
Mm-hmm.
do want to raise awareness of making sure that, if you are going to go that route, I'd rather go to the shelter and get a fully vaccinated dog. But
Yeah.
if you are going to go, that route, that you go to a clinic and make sure that if they do have any vaccination records, because it is
Mm-hmm.
something that we see here and it does spread pretty
Mm-hmm.
fast. So,
Yeah.
and then can we talk about vaccines required for cats?
Yeah. So for cats, we always recommend the feline leukemia
Mm-hmm.
virus vaccine, and then the FERCP vaccine, which that one covers all the upper respiratory infections that are very common amongst cats, and then of course rabies,
Mm-hmm.
which is required by law here in El Paso.
Yes. And just to go back to again a little bit of like litter season here, of
Mm-hmm.
course, we kind of in the southern states, because of how we don't really get a full winter, we're constantly seeing puppies and kittens coming in. But can you talk more about overpopulation and what you see clinic side?
Yeah, so litter season is more common with cats.
Mm-hmm.
Reason being is that the light affects their ability to go into heat. So normally we'll see a big boom in kittens being born during late spring and the summer, because that's when days are longer and there's more light outside. Indoor cats, however, can be affected by artificial lighting, so all our indoor lights. So I think it's more common for indoor cats to give birth anytime throughout the year, but for outdoor cats, like all the feral and stray cats out there, we'll see that big boom during late spring and summer for that reason. Just the natural light and the longer days actually affect their hormones, and they'll go into heat more
Mm-hmm.
commonly.
Yeah, so important to get our cats spayed and neutered
Yes,
as well.
yes.
Is there anything else that you would like to add about, vaccinating or spaying and neutering for El Paso community to know any other myths or misconceptions that you might have heard?
Yeah, so the initial vaccines are important when they're puppies and kittens. They, like I said, they need those series of boosters from as early as 6 weeks old all the way to 20 weeks old. But it doesn't end there. Some people think, well, they got their first vaccines, we're done for their life. But they do need annual vaccines every year for the rest of their life. So the nice part is, as adults, it's just a once a year thing. For kennel cough, though, sometimes it is recommended every 6 months if they do commonly go to public places like groomers and dog parks. But yeah, this is a lifelong thing where they need vaccines. And going back to the backyard breeders, if they claim that they're vaccinated, get proof of it and make sure that it is from an actual veterinarian here in El Paso. A lot of breeders will buy their own vaccines from Tractor Supply or wherever. Um, and that's fine, but vaccines are just very sensitive to temperature, especially, and the amount of time that they're sitting outside. They can actually expire. So if they get warm, it can deactivate it. If they're sitting outside for, I believe it's as short as 20 minutes, they can deactivate. So even if breeders say, yeah, here's the vaccines I bought, it's still in question if they follow the temperature and timing guidelines. So it is always better, even if you have that proof, still take them to your veterinarian to get a full physical exam. And if they need to repeat vaccines, they can.
Awesome. Anything else that you would like to mention? I think we covered pretty
I
much
think we covered it
everything,
all. Yes,
right?
spay and neuter your animals.
Yes, definitely. I think that's the big thing that we really wanted to talk about, because that overpopulation, and not only that, but the health
Health
benefits. The health
benefits for
benefits
sure.
are definitely going to get your pet to stay with you longer. And I think
Mm-hmm.
that's the real goal is, you want your pet to stay with you longer. If you really love your pet, you're going to want to do what's best for them. And there's a lot of resources out there, because I know that sometimes it can be a little bit expensive, but there are resources out there that for our community as well. Well, thank you so much for joining us. We appreciate taking time to do this, out of your busy schedule.
Thank you for having me.
And we hope that you all enjoyed this episode, and we'll see you next time.